Good morning. Thank you for joining CARES today for the first Partners in Progress workshop of 2021 on the COVID-19 vaccine, dispelling myths and building confidence. Many among you are homeless service providers who are familiar with the Partners in Progress workshop series, and we're so glad you're with us again today. For others unfamiliar, the Partners in Progress workshop series was developed by CARES to provide information on timely topics that homeless service providers across New York State and HUD identify as important in our work to reduce homelessness. We welcome everyone from different service systems across New York State. Our goal today is to help everyone working tirelessly on the front lines during this most challenging time to remain safe and feel confident about both receiving the vaccine yourself and encouraging your friends, family members, and clients to do the same. We have CDPHP to thank for helping us put this important program together. Kathy Leiden, Natalia Burkhart, and Allie Skinner orchestrated much of the process, including recruiting our two incredibly knowledgeable speakers. And Allie will also serve as our skilled facilitator today. Thank you, Allie. Our speakers are Dr. Adatona, who is a practicing physician and director of the Lansingburg Family Practice, and Dr. Brenda Robinson, the founder and CEO of the Black Nurses Coalition. I have the utmost confidence that they will convince us, those of us with questions, that the COVID-19 vaccine is very much safe and beyond worth receiving. It is an honor. Thank you very much, doctors. Before passing the torch to Allie and Drs. Adatona and Robinson, please keep in mind that today's speakers will not address questions about where and when we might receive the vaccine, but definitely the why and definitely the yes about receiving the vaccine as soon as we are eligible to receive it and it becomes available. Now let's get this ball rolling.
Myself, I'll just give you some statistics or data for us to think about while this presentation is being done this morning. COVID has affected everybody. It has infected 1 in 12 adults, almost 28 million infected, 1 in 800 dead. The percentage of our children being infected is going up. It's changed our life all over. So when we now give you all the information we know about COVID, I think everybody should be informed enough and convinced and go out and get the vaccine. Not only go out and get the vaccine, you need to recruit everybody in the community to get the vaccine. Thank you.
Next up, Dr. Brenda Robinson, who is the CEO and the founder of the Black Nurses Coalition. Brenda, why don't you introduce yourself? Give us a little insight of what it's been like for you and your organization being on the front lines of this pandemic.
Thank you. And as she said, my name is Dr. Brenda. I wear several other hats. Are you able to hear me?
Yep, you cut in and out a little bit, but that's okay.
All right. I am also chair of the City of Albany Commission on Human Rights, and I wear a lot of other hats. I'm also an employee of the Veteran Health Administration for over 27 years. So, I carry a mission of eliminating healthcare disparities, and my organization has always been on the front line dealing with the whole range of health disparities. And of course, COVID-19 shed light on the actual healthcare disparities. So for me, being on that front line, dealing with folks from mental health issues, which we all know has increased, fears, loss, pain, social issues, poverty, all of those things I face on a day-to-day basis when I engage the community. And it's been really hard for folks. We have been working so diligently, organizing vaccines, advocating, and it's been truly, truly a lot of work. And I do commend all the folks who are working hard to help get us all through this COVID-19 pandemic, because a lot of people on the front lines, and we need everybody.
Perfect segue, because I think that, that's what we're doing here today. Together, we're educating people and we're getting the word out about the vaccine and the importance of the vaccine. So thank you so much, ladies, for those introductions. I think the first thing that's on so many people's minds as we look at a vaccine or multiple vaccines that have really truly been developed in record time, you got to question, you got to question whether or not the makeup of the vaccine, what you're putting into your body is safe. So I want to ask both of you, first thing right off the rip, so we can get this out of the way, are the vaccines safe? And either of you jump in first.
Well, I think firstly, I guess I'll jump in first. One of the first things I would just like to mention is about the vaccine itself. We have 2 vaccines authorized via emergency use authorization by the FDA, because that's often a question. Right now, we have 2 vaccines. We have the Pfizer and the Moderna, right? And it's a lot of concern about vaccines and how they came about so swiftly, as you mentioned. These 2 vaccines are the messenger RNA vaccines, which is not a weakened or reactivated virus. Folks feel they're getting a virus. No, you are not. So the messenger RNA vaccine contains that genetic code from the coronavirus, the code, not the virus, it's the code. And when we get vaccinated, it triggers our immune response and antibodies are made. So in the event that we do come in contact with COVID-19, our immune system will know it and be able to fight it. So we're not, this vaccine is not the actual COVID-19 virus. So a lot of folks fear that, and I just want to clear that up. The other thing that I would like to mention is with the messenger RNA, yes, it's been new for the coronavirus, this particular vaccine, but the technology, the thought process behind it is not new. So I just wanted to certainly dispel that, because some folks, even myself, before I did all my research, I'm like, wow, that, they told us 18 months, they told us all these things, but now we're getting this so quickly. How did this happen? Well, the actual technology to actually pull this through with messenger RNA is not new, and it has been around. So I just wanted to really clarify that. And another question that came up in regards to the vaccine is actually what is in it. So, we have our messenger RNA, we have that code, right? We also have lipids. Lipids help the vaccine slide right into our cells. We also have salt, which, with the acidity, we need that, and as well as basic sugar. And sugar helps with the balance and the preservation of the vaccine because the vaccine is frozen. So these are the simple things that are actually in that vaccine. You are not getting the virus. No one is injecting you with that. So I just wanted to just be so clear on that. And RNA and DNA is 2 different things. We're not changing your DNA. So I just really want to express that. And I'm glad you asked that question.
Yeah, that was really good information. And you talk about the different elements that are also in it too. Just fascinating. I didn't realize that there was even sugar, something as simple as that. So, you tackled a couple of questions there. Is the vaccine safe? What's inside the vaccine? I think, but maybe as a parent or, somebody with a loved one who will be getting the vaccine, does your professional opinion, Dr. Adatona, I'm going to ask you this, differ from your personal opinion on this? And I know that's a tough question to answer, but is there a line between what a physician would tell us and kind of what we feel a little on the outside?
Just like everybody has felt during the pandemic, for me, it has been a journey. My personal opinion was polar opposite of medical opinion. Now we're in sync. Obviously worried. Never has it been known that a vaccine has been made in such a short time. So the question of trust, safety, efficiency needed to be answered. But I must say that my personal opinion now and my medical opinion are in sync. And it has been a journey for me. And this is through education. I needed to educate myself. I needed to read about the data so that I can give informed information to my patient, because when they come in, I deal with COVID every single day. Either somebody calling or my patients coming in, and I really need to give them the right answers and the right information. Remember, my code is do no harm. So by advising patients, do not get the vaccine my personal opinion in the first instance at the beginning of this pandemic is actually the wrong one. So that's why I'm passionate, all for the vaccine. I've researched about the vaccine, and I'll share that with you. But it has been a journey, and I'm sure everybody is still going through the journey. By the end of this, with all the information you're going to get, you're going to make the right decision that the benefit of this vaccine really outweighs the risk of the COVID virus itself.
And that's so refreshing to hear
And
that you're actually sharing, your personal feelings and sharing the transparency that I was hesitant in the beginning, but through
right, right.
education, I was able to get there. Dr. Robinson, did you want to pivot off of that?
Yeah, I do echo the doctor's sentiments as well. For me, my personal and um, medical position was really one of the same. So I was certainly wasn't going to be the first one to line up to get this vaccine. I had to do my research. A lot of people would ask me about the vaccine, and I would say, well, the jury's still out with me. I have to complete my research. And once I completed my research and came up with my decision, I went step by step. I did a live forum just to let folks know the steps I took to come up with a decision that was good for myself, good for my family, and good for the folks that I serve. And I think a lot of people respected that because I went through step by step, letting them know I'm not just, willy-nilly telling you this is the right thing to do because a group of other people are doing it. No, these are the reasons why I came to my decision in regards to taking the vaccine. And I agree with the doc that for me, the benefits outweigh the risk of the vaccine. So
There still is skepticism out there. And I think that's one of the reasons that we're doing this here today. And, notably in the news recently, there's been a lot of reports that those of Black and Brown communities are significantly more hesitant to get the vaccine. I think I saw a statistic where it said, 8 or 9 out of 10 white people going to get the vaccine, 4 out of 10 people of color say they're going to get the vaccine. Why do you think that is?
Well, for me, in my personal experience, being one of those Black people, we have a history rich in maltreatment of Black and Brown people, especially in healthcare.
Mm-hmm.
We have to remember that generational trauma does exist. We, especially during Black History Month, hear about slavery. You may hear about the Tuskegee experiments with syphilis. Some may even hear about the forced sterilization of Black and Brown women back in the 60s that was supported by Medicaid and Medicare. Medical apartheid is real, and maltreatment happens each and every day, not just way back in the 60s, but we can look at today and we can look at yesterday as well. Unequal treatment has been identified by the Institute of Medicine and several other scholarly organizations. When you look in the paper today, even with the COVID-19 vaccines, you see the unequal distribution. So trust has been broken with the healthcare system and people of color and poor people as well. That trust issue is certainly, once you break it, it's hard to get it back. Skepticism is valid, and we need to realize that because this carries over until today. And these are discussions that have to be had. There's nothing wrong with talking about them. We got to get more comfortable in talking about it, but we do have to realize that that generational trauma is here and it is real, and skepticism is valid.
Dr. Adatona, you practice in Lansingburg, which was a very diverse community. What are you seeing from your patients? Do you have patients who, are leaning toward being skeptical?
Majority of my patients, I must say that in the beginning, they're skeptical. Now with more education about this vaccine, they're beginning to see the benefit of the vaccine. Like Dr. Robinson had said, is a question of trust and what has happened to people in the past. So we are in a position, Dr. Robinson and myself and so many other people, to convince that this wasn't like the past. This is different. And don't forget as well that in the beginning, it was also politicized. So that is actually being eroded now. And people are seeing that this is real, and the vaccine is out there and is not being an experimental thing for the minority or the underserved.
What could we be doing?
Can I just interrupt? I just also like to add that I'm working with the vaccine clinics, and we have more people, Black and brown people, who want this vaccine than we have spots for. So they are getting the message. I just wanted to add that.
Good. What more can we be doing, though? What more can the CDPHPs of the world, the government be doing, other healthcare providers?
I think, speaking of CDPHP, I think some great things as far as having people of color at the table, supporting events, and I know CDPHP does do that. We need to be transparent. We need to have accountability. To build up trust, we must do these things. But I do feel a lot of big organizations, again, like CDPHP and other places, are supporting grassroots effort to get the word out, to engage so that we can try to come together and create a level field, bring back trust and faith in the healthcare system, and try to provide that health equity and that cultural competence that's needed. So big organizations such as yours certainly uplift the effort, because grassroots folks can't do it alone. So if we continue this effort together, I think we may continue to make a large impact.
Walk the walk.
Got that right.
Dr. A, do you have anything to add to that?
Yes, I completely support what Dr. Robinson said. It's just education, being out there and creating the trust, building a bridge. And CDPHP is doing a lot of work as well in that regards out there in the community, so that people come to trust. When you trust, you tend to get better results.
Absolutely. So let's pivot a little bit. There's a couple of different options out there. We don't necessarily get to choose what option we want right now because supply is so limited, and we do have some other vaccines coming down the pipeline. But you had mentioned before, Dr. Robinson, that there's two different versions of this shot right now. We've got Moderna and we've got Pfizer. Can you explain the difference between the two of them and anything that consumers or patients should know?
I think some of the bigger differences between Pfizer and Moderna is, well, for one, you don't have a choice. When you go get your vaccine, you don't have a choice. You're going to get Pfizer or Moderna, and they tell you that. For Pfizer, is 16 years of age and older. For Moderna, is 18 years and older. Mm-hmm. They both are 2 doses. So some people think, I'll get Moderna, I only have 1 dose. No, they both require 2 doses. And when you do get your vaccine, you get your date of the second vaccine right then and there. So Moderna is one that needs to be, has no dilution, whereas Pfizer, you have to dilute it and do different things. So I think primarily they're similar in the fact that you have to get the 2 doses. Pfizer, your second dose is 21 days. Moderna, your second dose is 28 days. So they're very similar. You're going to go through the same process in regards to getting these vaccines.
We've also seen in recent news that because of availability, some people are getting, their second dose is being delayed, maybe not outside that 21-day window. Right. Should we be concerned about that? What happens if Dr. Adatona, what happens if I miss my second shot? Do I have to start back over again, or what does that look like?
No, you shouldn't be concerned about that, and you shouldn't be worried. You just get it when it is available. You have to remember that these vaccines, they're winners. It really, so long as you get your second dose, it's like you've been engaged and you're going to get married. And for whatever reason, your wedding date is shifted because of the COVID. This still doesn't mean you're not going to get married. You're going to get married when the time is right. So when the vaccine is available, you should get the second vaccine, because that is what science has shown that that is needed to have 95 protection or efficiency of these vaccines.
Got it. Just like marriage. I love it. So we do have a question from one of our guests that's on here today. And we had some of these questions also when you guys registered. So they're all kind of syncing up a little bit, but we've heard a lot about side effects. You know, some people experience them, some people don't experience them at all. So what is the research showing about long-term side or short-term side effects and then long-term side effects?
So I guess I'll take that. For the short-term side effects, often you have the local reactions. You could have soreness at the site, swelling, redness. Some folks experience that. You can have some systemic side effects such as fever, weakness, tiredness. Some people have some cold or flu-like symptoms at times as well. The second dose, people have been concerned in regards to that because some folks have really gotten flu-like symptoms or cold-like symptoms, which dissipated in 1 to 2 days. So from the research and the folks that I've dealt with and some of the colleagues I talked to, those have been the basic symptoms. For me, when I got my first shot, when I got home, probably about a couple hours later, I was so tired, I could barely hold my eyes open. And that was the only really reaction that I had received. So all our bodies are different. Reactions can be different, but they so far have been mild from the research that I have seen. One thing that has came up is Bell's palsy, because I saw a video circulating in regards to Bell's palsy, and it was an African-American nurse, and she had Bell's palsy. So I looked at the research to really ascertain what was the incidence of Bell's palsy with the research that has already been done. So when I looked at that, I saw it was approximately 7 people who had Bell's palsy, and it dissipated on its own, right? If you don't know what Bell's palsy is, it's the weakness of the muscle on either side of your face, right? So I looked at those 7 people, did dissipate, and I said, So I'm looking at her video again, saying people are really concerned about that. And I started getting other calls about it. So I did a little bit more research, and it's about 40,000 people who are affected with Bell's palsy every year with nothing being done, just pops up, just happens, 40,000. So we have about 40,000 folks who are getting Bell's palsy, and the majority of it just resolves. You can get it from medication, or it just happens sometimes. 40,000, and we get 7 people with the vaccine and the research. I think we're okay with the Bell's palsy. I'm not concerned about that. So I think we can set that aside, being that we know typically with nothing going on, we have 40,000 people who are impacted by that. So we can put that away.
Facts. Just laying out the facts. I love it. Dr. Adetona, what about those? I know we've gotten some questions about anybody who may have a compromised immune system. Should they worry about side effects from the vaccines?
I don't think they should worry about side effects. We have to remember the very immune compromised patients, they're the one at risk if they should get COVID infection. So they need to be protected. And when they did the phases trials, although they didn't include patients with some patients with that had immune issues, but they had people with chronic diseases with the phase trials, and they all did well. There was no concerns, no long-term side effect, no short-term side effects so far. So they should get it.
Why do you think,
So
Dr. Adetona? Sorry about.
Yes, for me, for the compromised immune system folks, I would like them to check with their provider prior to them getting the vaccine.
Okay.
Okay, let me just say, so anybody if you've had a transplant, you should wait at least 6 months before you get the vaccine. Otherwise, I don't think there's anything out there that is saying that is saying, I know the cancer doctors are a little bit wary. I don't think they're at the comfort stage right now, but all indication is at some stage, maybe with more data and with more research out, they will be comfortable with the vaccine.
Got it. Why do you think it is that people are experiencing more of these side effects? And I don't want to belabor the issue, but I know we got a lot of questions about it, so I want to be transparent. Why the second shot? Why is that one having a greater impact on some folks?
This is
Well, that was mentioned early on with the research that the second shot typically would have a stronger reaction. So I that makes me more positive about the research, because the research did identify that the second shot has been known, if you're going to have a stronger reaction, it is going to be that second shot. So for me, I know the folks did their homework because they identified that early on. I'm sorry, go ahead, Dr. Adekun.
It's just a result of the second boost to the immune system. So the immune system is having to do more work. And it's just showing that your immune is good and doing what it's supposed to do.
Dr. Adetona, we have a follow-up question here for you. You had mentioned concern for transplant patients receiving the vaccine and waiting 6 months after the operation. What about any other surgeries?
No other surgery that I'm aware of that has to wait. The only other people that also needs to wait is if you've gotten the immunoglobulin to treat you after you've had the COVID or any of those kind of treatment, you should also wait before you get the immunization.
Okay. So we've heard that anybody who has had COVID over here has a little bit of immunity for a while, or has the antibodies. How long do those antibodies last? And how long do I have to get a vaccine from the time I had COVID to maintain my protection?
Okay, this is to me, I guess, or Dr. Robinson?
Yeah.
You can go ahead, I can go after, it doesn't matter.
Okay, so we don't know how long the immunity lasts after a natural infection, but the reason why 90 days is the number. This is simply to allow, because we have shortage of this vaccination, is to allow other people who don't have any immunity whatsoever to have some immunity. That's the reason why the 90 days is on. Otherwise, you could get your shot right after you recovered from the COVID infection.
Dr. Robinson, anything more to add?
No, I don't have anything to add.
Okay. So children, we know that children aren't getting most children are not getting sick at all. And many children are not getting the symptoms as some older folks. So what do we know about children's ability to contract and also carry the disease and the spread of the disease as a result of kids?
So children do get COVID, but luckily for us, they just tend to present with milder symptoms. And when children do get this disease, from the data that has been done, it shows that if you measure the amount of virus they have in the nasal passage, is a lot higher than that of the adults. And hence, I'm sure you've heard of the terminology, the super spreaders. The children then have the ability to spread the infection faster than the adults can. We shouldn't be under any illusion. CDC released that there's an increase in the number of children getting infected. I think it's gotten to about 16%. It's gotten to 16% simply because the number of COVID infection in the general population is also increasing. That is probably why the children are getting more infected. And I have had the experience of a child getting infected, infecting the whole of the family, and the child recovering, and shortly after that, getting infected again, and ending up with something called the multi-system inflammatory syndrome. This happened to that patient. And I actually thought that I was going to lose the patient. Luckily, he's done well. So it is real. It is out there. When you get, at times, if you're unfortunate, you get COVID the second time round, you may be a lot sicker than the first time round.
Wow. I don't think we knew
And
that.
also with that, I think that was an excellent answer. But also with that, setting aside certain groups, saying that, you know, oftentimes people think this particular group cannot be impacted by COVID and cannot get COVID-19. We need to just stop doing that because everyone is at risk. Everyone.
Yeah. My daughter lovingly brought it home from gymnastics, so I'm well aware of that. So this question is for both of you. Women who are pregnant and breastfeeding. I know when it comes to the flu season, a lot of people are a little skeptical if they're, you know, nursing a child or carrying a child. I'll start with you, Dr. Adatona. Would you recommend, and are you recommending, you know, women who are pregnant and breastfeeding get the vaccine?
Okay. So back again to COVID, I told you about my journey. Everything is data and science. We've got to believe in the science that is available. CDC and ACOG, American Association of Obstetrics and Gynecologists, they have recommended that pregnant women, breastfeeding women who are eligible should go ahead and get the COVID vaccine. It's as simple as that. And like, if you're immunized late in pregnancy, the chances are you're going to transfer the antibodies through the placenta to the baby. So just like the flu, pregnant women are immunized during the flu season is the same rationale that the antibodies that the mother produces will transfer and protect that baby, at least for the initial few months of life. In the case of the flu, it is 6 months. In the case of COVID, we still don't know. We're waiting to get the full data on that. But pregnant women, please don't be afraid. Go ahead and get the vaccination.
Sounds like absolute
For
reason
me,
to do that.
yeah, for me, it's not enough science in regards to pregnant women and the COVID-19 vaccine. And that's my opinion on that.
Okay, fair enough. Fair enough. We obviously, children are not able to get the vaccine right now because of, you know, under the age of 18, the vaccines have not been approved by the FDA. What are some things that parents should be doing, you know, besides all of the normal social distancing? How do we ensure that, you know, children aren't lovingly bringing this into our homes?
Right. I think parents, aunts, uncles, grandparents who are around children have a lot of work to do, and it's ongoing work because it's easy to get complacent, but we got to make sure we keep our regimens up as far as cleaning those doorknobs, disinfecting surfaces. Sometimes we get a little complacent and they talk about the COVID-19 fatigue and we get set in our ways, but we have to continue to wear these masks. We have to continue to make sure we are disinfecting that bathroom. We have to continue to make sure that we are cleaning those toys, and you know, your little ones get to a lot of places you may not think that they get to, and we got to make sure that we hit those areas. You know, we can't relax on it. We can't say we have the vaccine and everything is great. We can't get set in those lackadaisical type of ways. We have to stay vigilant at home, abroad, even in our offices. We have to stay vigilant.
We had a clarifying question here about the vaccine for children. Came from Stephanie Uber. She says, I want to clarify, can teens ages 16 and up get the Pfizer vaccine? I thought I heard that a little bit earlier.
Yes.
Yes, 16 and older. 16 and older.
For the Pfizer.
Okay, great. Glad
for
you were
Pfizer.
Yes, and yes, 18 and older for Moderna.
And 18 for Moderna.
And another follow-up question, how long do we expect our immunity to last after we get the vaccine? And we've also seen a lot of questions about, or, you know, some reports coming out about the booster shots. So
Well, we still have a lot of uncertainty and a lot of research still going on. And I think it's okay to admit that research is still going on and there is some uncertainty about whether we're going to have a booster, how long is the immunity going to last. Again, even with the emergency use authorization, it's mandated that research continues. And that's exactly what they're doing. And I do believe once the data is in, I think all of us would be the first to actually know and giving guidance on which way to go with that. We can all speculate, but we do have to wait for the science.
Dr. Adatona?
Yeah, I agree with Dr. Robinson. That's there's still a lot we don't know. Luckily, data is being collected every day with millions and millions of people being immunized. So soon, I'm pretty sure things will be coming out, and it's still going to come out over the next few years.
Right. And the benefits certainly for larger groups of folks outweigh the risk.
One interesting fact I saw the other day was that I think the CDC had reported something along the lines of 7 flu cases, which is obviously unprecedented. Do you think that this changing environment that we've seen, obviously over the last 12 months, is going to, have obviously significant impacts on flu, but then get to a place where we can do similar things with COVID with the precautions in place?
Yes, it goes to show you that the masking, the social distancing, they mustn't be disregarded, and we mustn't let our guard down. It has, even in my own practice, I'm seeing less of respiratory infection coming in. So in fact, when I see anybody who's got a respiratory infection, the first thing I'm thinking about, I've got to rule out COVID. I'm not even thinking about flu as I used to. I think
Yeah.
about COVID, simply because the masking, the social distancing has just reduced a lot of transmissible diseases.
Mhm.
And I certainly agree with you. I work in a primary care office on Mondays, and I'm seeing the exact same thing. And we are thinking about COVID, and we're giving those tests.
Mm.
What about the variant strains that we're hearing about that, are mostly in Europe right now, but we have seen a few cases locally. What are your concerns, anxieties about those? And, are our current vaccines, will they protect us from those variants?
I'm very glad we brought up the question of the variant. Yes, some of the vaccines that are available, they do cover the variant, but not as good as the original COVID. And let me explain some more things to you about variant. Variants are 50% more transmissible than the original COVID, and they're very more virulent than the original COVID. The virulence is happening because we're getting a lot of infection. The more people are infected, the more the chances will go up that we'll get more variant. Now we're worried about UK, South Africa, and Brazilian variants. If we don't contain COVID, we run the risk of even having more variant, that the more disastrous. So if you think what has happened in the past was a disaster, if you don't contain it, the variant will be worse. I mean, it's been speculated that the variant may be worse than what has happened in the past. So the only way one of the ways actually, don't let me say the only, one of the ways to control, or many ways to control the variant, is to get the whole community as much as possible immunized, so that the chances of infection, the number of people being infected, is drastically reduced. And again, the masking and the social distancing, they all go together.
And Dr. Robinson, is this the same as sort of like when the flu comes out every year
Right.
and we have vaccines for the flu, it only protects against certain.
Right. It's funny. I was just going to mention that the different strains of the flu that we get, and we get our flu vaccines, and oftentimes you may get a vaccine for a particular strain because they make the vaccines in advance, and then you have something else on the scene. But I think that goes to show that with COVID-19 and you look at influenza and the different strains of influenza, we can be safe again. I think it should give people hope. It should give them inspiration. It should let them see a glim of light at the end of the tunnel. Because with influenza, we still been living our lives and moving accordingly. And a lot of us has been safe. Yes, we lose a lot of folks with influenza as well, but we still are living a wholesome life. So I think looking at the flu and the different strains with that should give folks some hope that we can do the right thing.
Let's talk about hope. Let's talk about getting back to normal and doing the things that we love to do. I know a lot of people are dying to get out of this cold weather and maybe start traveling again. What are your thoughts about traveling and, particularly after you have the vaccine or maybe if you don't have the vaccine?
So traveling, so far, there is no requirement to travel. But if you're traveling domestically, there's no requirement whatsoever. But if you're traveling internationally, they require you to get a COVID test done before you get on the plane. But I can see this coming down the pipeline, that some countries will mandate when the vaccine is readily available everywhere, that they'll mandate that you've got to be vaccinated before you come to the country or even the airlines before you board the plane. Because if you remember, in the time of smallpox, there's some countries that you can't go to without showing evidence of smallpox and yellow fever immunization. It may come down to that, and I won't be surprised if it does, because this is a pandemic. It's affected every single one.
And Dr. Robinson, go ahead.
Also, I just like to make a comment about domestic travel. Folks are still traveling. I do advise folks to make sure that wherever your destination is, you find out what are the mask requirements, what are their restrictions, and what are they doing in regards to COVID-19 and the precautions. Do you have to quarantine? Are masks mandated in that particular area where you're going? You need to know these things before you travel, whether domestic or abroad. So you may go to Florida and find something a little bit different.
Mm-hmm. And do you think that any of these restrictions will be lifted if, we get to a point where everybody's fully vaccinated?
I think eventually, hopefully, we will go back to regular travel, I think, eventually.
Okay. All right. So I know that we have about 10 minutes left. So I want to open it up to the group. You guys have been great sending questions all along, but I want to make sure that we get to your questions. So please put any messages in the chat function right now, and we'll be happy to address them. I'm just going to scan right now and make sure there's nothing that I missed. I think we've gotten to pretty much all of them right now. Any last thoughts from Dr. Adatona and Dr. Robinson? Dr. Adatona, you want to go first with some closing remarks?
Thank you. Yes. We've all seen the devastation caused by the COVID. It's affected us in every way. This is what I wake up to. This is what I deal with. I'm worried about my children far away from home. I'm worried about my grandchildren. I'm even worried. My grandchildren are still young. They're preschoolers. I'm worried. Are they going to be able to go to school? Are they going to be able to have a normal life? Would we have gotten control of this virus so that we have some form of normality back into our life? The vaccine is very much, it's never been known that a vaccine has been this effective, this efficient in the vaccine world. Despite all the skepticism, this is just because we had collaboration internationally and nationally to develop this vaccine, to make people safe, to get us our life back. The COVID itself is very devastating. And like I said, the risk of getting the natural vaccine, the natural COVID, far outweighs the benefit that this vaccine has offered or is going to offer us. So we all have to make an informed decision with everything that is being said. I'm sure you pick vaccine over the natural infection, because if you don't get the vaccine, your choice is at some stage, you may be infected. And remember, we have the variant. We're just not talking about the old COVID. We're talking about the new variation of the COVID. So, and I hope with this, everybody is going to go there and going to be the ambassador for the COVID vaccine. Thank you.
Beautifully said. Thank you. Dr. Robinson?
Those were great, great comments, and I certainly share that sentiment. I would like to also add, in regards to the COVID-19 vaccine, it has been very difficult for people of color, the Black and brown folks, and we know that minorities have been disproportionately impacted by COVID-19. So we certainly want to make sure that we increase the availability and the access to this vaccine. Some of the things, or one of the things that I have experienced in the community is that folks are really signing up for the vaccine and have difficulty getting access. So those folks, if you encounter difficulty getting access to the vaccine, please stay the course, stay hopeful, stay encouraged, because you will be able to get the vaccine. I know it's discouraging for some folks. I had one individual who was scheduled for the vaccine and got canceled because the vaccine did not arrive. The person was upset and then said they no longer wanted it. Please do not get discouraged. If you're signed up for the vaccine, or if you're trying to get into whatever site you can't get in, please do not get discouraged. Keep the faith. The access will be there. Please stay encouraged. Thank you.
Wonderful. So there were a couple of questions that came in that I just want to address, just because they were personal medical questions. And for those people who asked those questions, I think both Doctors Adatona and Robinson would agree that you should speak to your personal doctor in order to get those questions answered. There is one question, though, that I do want to ask both of you ladies before we wrap up, because I realized we got it a couple of times. Can a vaccinated person still carry COVID?
Yes, 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 yes.
Yeah.
So the vaccine itself, it's supposed to protect us or prevent us against severe illness, ending up hospitalization and death. It also reduces the risk of transmission by maybe 50 to 70%. But I tell you what, the COVID that infects the nostril, the vaccine doesn't protect against that. It's an IgA antibody that protects against that, which the vaccine doesn't produce. So hence, after you've been immunized, you still need to wear your mask until they tell us otherwise.
Got it.
So you can still be a carrier, a symptomatic carrier. You won't know you have it. So you can potentially get other people sick around you.
Wow.
That's the risk.
So vaccinated or not, stay the course, keep your precautions. They're still in effect.
Excellent advice from both of you today. I really appreciate you taking the time out of your very busy schedules. I know that you're both very active in the local healthcare space, and you're treasures in our community. So we really appreciate you. And we had a big crowd here today. So I know Maggie from CARES is certainly pleased to see all the participants on the line and all the engagement. So I'm going to gladly turn it back over to her to make some closing remarks. Mute. I think you're on mute. There you go.
Sorry, I was busy listening to you all. Wealth of information. Thank you so very much. Allie, Dr. Adatona, Dr. Robinson. Thank you so much for your time. And thanks to our audience. We hope your questions have been answered, at least most of them. hopefully your fears dispelled, and hopefully you and yours will be the next in line to receive the COVID vaccine as soon as it becomes available. Please know that this presentation has been recorded and will ultimately be up on the CARES website. And I do know that our doctors, our knowledgeable doctors, each you can look up, they too have additional information on these subjects. So if you want to Google them, you will find other additional information from them. We hope to be in touch soon about the next Partners in Progress workshop on the New York State Emergency Eviction and Foreclosure Prevention Act. Until then, please have a great rest of your day, good weekend, and Black History Month. Take care, everyone.
Thank you.
Bye.
Thank you.
Bye.